Hello, my name is Mohit from Imedicare, area manager for Midlands and Wales, and I'll be giving a talk today about some of Imedicare solutions for male erectile dysfunction, Peyronie's disease, premature ejaculation, and urinary incontinence. So you can see here some background information on erectile dysfunction and the penis. So the penis's main structures are the glans penis or the head, the corpus spongiosum, and through which the urethra runs, and then the corpus cavernosa, which, when engorged, provide an erection. Now, if the penis suffers from a lack of blood flow for whatever reason, for example, after radical prostatectomy, then the penile tissue suffers as a result of the lack of blood flow and exercise that erections provide. So without nocturnal erections, the penis suffers quite often a non-use atrophy, and scarring can occur as a result, as well as the inability to be intimate and the psychological impact that comes with that, and the shrinkage of the penis and inability to perform sexually. So there are a number of treatments that men can use for erectile dysfunction, one of them being a medical vacuum erection device. So the Erect range of medical vacuum devices are the most widely prescribed in the country, in the UK. There's low cost, a 5-year warranty, and in many parts of the country, they are available on prescription through the GPs. Some parts of the country, unfortunately, don't provide them on a prescription, however. Patients always have access, however, to the free education service that Imedicare provide in clinic or at home, or virtually, where we can provide education, free education on how to safely and properly use a device and any troubleshooting thereafter. We can ensure that the patient gets the correct fit, and learns how to use the rings for sex. Now, the device works with the body's natural function. So it draws blood into the penis using negative pressure, and that blood feeds the penis, stretches it, and basically replaces and replicates the natural erections that we ought to be getting every night. So it improves the vascular system. So it's therapeutic, non-invasive, minimal side effects. I'll be touching on the contraindications later. And with the correct usage, training, and a device that works, it guarantees an erection. So I've got a device here. The medical vacuum pump here should not be washed, otherwise it would be ruined. There's a lever to pump with. There is a battery-operated version for those with poor manual dexterity, and a button to release the pressure. A cylinder for the penis to go into, which is 8 inches long, and some seals at the bottom ensure comfort, but also provide a good surface to apply water-based lubricant so that a vacuum seal can be maintained. The penis should be lubricated also, and pubic hair kept trim. When the penis is inside, the scrotum should be held with the other hand to ensure that it does not get drawn in. Pumping must always be done slowly, 3 pumps, followed by a 5 to 10 second interval to allow engorgement, and this is repeated until erection. Now, those with the non-use atrophy of the penis often have a stretching pain when they get to a semi-erection. When the stretching discomfort is experienced, they should stop pumping, hold the erection there for 5 seconds before releasing the pressure. This constitutes 1 repetition of the penile exercise, and this is repeated for 10 minutes daily in a single session. And we provide comprehensive training on how that is done safely. This is repeated every day for 4 weeks, in most cases, until the non-use atrophy of the penis is reversed, and the patient is now able to get a full erection within the vacuum tube. At this point, the patient can start to use the device for intercourse. However, they must continue using the pump regularly to maintain the health and fitness of the penile tissue and prevent any future non-use atrophy. As long as the device is used a minimum of 3 times a week, they can prevent any future atrophy. In order to use the device for intercourse, erection maintenance rings are used, and there's a variety of different rings that can be used for that purpose. These are the most popular, the ultimate sure fit, so I demonstrate. The ring is applied onto the base of the device. An erection is achieved, and the ring is transferred onto the base of the erect penis, and the erection is maintained. With correct application, an erection good enough for penetrative sex is quite easily achieved. A ring can be worn for half an hour, never longer than that, so patient must not fall asleep with the ring on. The rings are removed quite easily, allowing blood to leave the penis. After half an hour, the patient just needs a 10-minute rest before a ring can be reapplied. And if the erection fades during sex, they can try different ring sizes or types, or different sex positions to find what works best, or they might even need to use a second ring. Rings, if it's safe for a patient to use pills such as Viagra or sildenafil, tadalafil, Cialis, then a ring can be safely worn in conjunction with pill usage. So as aforementioned, it works with the body's natural process. So improves cellular metabolism and cell division, promotes neovascularization, so the formation of new blood vessels, and reduces the formation of scar tissue in the penis. So it's very beneficial for the penile health. And here we see a number of studies discussing the efficacy of vacuum pumps. So as aforementioned, we have a clinical or home or virtual demonstration service, completely free for patients, whether they be NHS or private patients, where we can discuss how the device is used and give the patients a tailor-made physiotherapy plan to ensure improved technique, satisfaction and compliance and results. So there's a low cost to the NHS as well, because there's a 5-year warranty. So the cost of the device spread over 5 years is very cheap. Patients can purchase the device privately. They'll get a lifetime warranty if that's the case, which means there's 10 component parts can be replaced. And the contraindications you can see here. For patients that use anticoagulant medication, as long as we have the approval from the clinician, it should be safe for them to use. However, we will ensure that the patient knows to pump extra slow. Now, Peyronie's disease occurs when scar tissue develops on the penis, resulting in a kink or bend in the penile tissue. This can happen randomly or due to trauma in the penis, and you can see in the instance it can happen 5 to 8% of men at some point in their lives. The disease is in 2 phases, where you have an acute phase and a chronic phase. During the acute phase, the disease is still developing, and that can last even up to 18 months in rare cases. And the chronic phase is when the disease is settled, it's no longer getting any worse. Some consultant urologists will recommend that patients start treating it immediately, where some will recommend that you wait into the chronic phase before treating it, because sometimes the disease can start to develop and then start to resolve itself. Now, a medical vacuum pump can be used to treat Peyronie's disease. So the Soma Correct system is the only medical vacuum pump in the country, in the UK, licensed to treat Peyronie's disease. What it consists is the standard response 2 device with some additional cylinders placed inside to restrict the ability of the penis to curve. So the patient will go through the initial physiotherapy stage I outlined earlier to improve the circulation, strengthen the penis, and reverse any shrinkage that may have occurred to the penis, especially if they already have some erectile dysfunction. After which they'll put in the smaller tubes and they'll then induce an erection. If the patient has a curvature, there now is less space for them to curve, and therefore, with every erection that we induce, we are applying a three-dimensional mechanical stress to the penis, focused on the scar tissue, which is consisting of a number of, well, an array of a matrix of collagen fibers that overlap and interlace in a very strong structure, a triple helix structure. With every erection that we induce, we are stretching that scar tissue. So the patient will pump up until they get an erection, fully hard, hold it for 5 seconds before releasing the pressure. And they repeat this 20 consecutive times in a single session, or they can break it up into 2 sessions in the day. And they do that every day for 6 months. Studies have shown that on average, after 6 months of treatment, patients are having a 50% reduction in the angle of curvature. So as you can see here, a number of studies agree with that. 50% reduction in the angle of curvature, 47% reduction, 49% reduction. All of these studies ended at 6 months, but we have a number of patients that continue to have really good results 7, 8, 9, or 10 months after commencing the treatment. Now, staying on Peyronie's disease, we also have the Pennymaster Pro, which is a traction device for treating Peyronie's disease. The glans chamber, which holds the head of the penis, is clipped to a frame, and you can stretch out the penis, providing a very strong traction force to the penis, which is going to quite literally, slowly over time, pull apart the cells of the penis, promoting new cells to form in these gaps, therefore lengthening the penis and counteracting the curvature, because if the penis is longer, it's going to look less curved. And also it's going to help pull apart the collagenous aspects of the plaque. It's used for 3 to 6 months every day, one for at least 2 hours a day. It promotes tissue expansion of the corpus cavernosa, and it can also be used for patients that have a calcification. So in approximately 15% of Peyronie's patients, a calcification will occur, which makes vacuum pumps not as effective at treating the curvature. So a traction device is often recommended. So you can see from the Moncada study here, on average, a 31-degree improvement in the curvature, which is 41% from the baseline. And in the Levine and Rybak study, up to 4 centimeters of penile length was gained. So it's used as a penile extender as well, not just for Peyronie's disease or patients with a micropenis, for example, or body dysmorphia, or who have lost some size from, for example, a radical prostatectomy or Nesbit's procedure, which is a surgery for Peyronie's disease, can use a traction device to restore a lot of that length. We also have another traction device, which is called the Restore X, a newer device developed in conjunction with the Mayo Clinic in the US, which provides conventional traction. You'll see a picture on the next slide, but also provides opposite angular force, which means, for example, if the patient's curving upwards, the device will bend the penis back the other way to basically help pull apart the plaque more effectively. So not just with the traction. And you can see from the results here, 94% of men gained length, and 77% of men had a reduction in the curvature of up to 28%. So you can see here you can see about in number 1 the clamp design, and number 2 about the counter traction, the opposite angular force that I mentioned. Now, what we have here is MyHICS/Med, and this is a treatment for premature ejaculation. And so it's a masturbation device, and patients will masturbate using it. But if they pay for the MyHICS/Med app, then on their phones, they can play a game at the same time, which provides cognitive behavioral therapy because it allows the patients to identify the different muscles involved in maintaining and controlling the ejaculation and erection. So some studies show that patients manage to improve their IELT score, the intravaginal ejaculatory latency time, by 7-fold. So for men that have premature ejaculation that are lasting less than 2 minutes, to increase that by 7-fold is life-changing for many men. So patients can reach out to us and have a discussion about the MyHIXO device. We'll be happy to go through that. Like all of our devices, it's a completely free education service we provide, whether that's face-to-face or online, virtually. Now, talking about some of our content solutions, Aphex is the most widely prescribed body-worn urinal in the UK. It's available on FP10 prescription, and patients can have a free trial on fitting. It consists of a receptacle to house the penis, which will connect to a series of bags, depending on the patient's requirements, and everything is held in place by a garment that provides enough pubic pressure to ensure that adhesives are not required. So for patients that have had bad experiences with other devices that have had adhesives, Aphex is ideal, as long as they've got at least an inch or so of penile length, so they're not severely retracted. Then they should be accommodated by the Aphex system. So patients that have had incontinence-associated dermatitis, for example, from adhesives, then Aphex is a great alternative. It can be used by patients that are very active, or those that are sedentary, those in a wheelchair, or those nocturnally incontinent. So there's a variety of bags that we can provide during the trial, and then the continence nurses can write to the GP, or the urology nurses can write to the GP and request it be provided on an FP10 prescription. We have the PaceyCuff Ultra here, which is a urethral control device developed by a vascular surgeon in Canada who found that there's a lack of safe penile clamps out there, because quite often they just restrict the blood vessels, they squeeze the penis and restrict the circulation to the penis, and were dangerous therefore. So the PaceyCuff occludes the urethra while ensuring that the circulation into the penis is not compromised, and this was supported by Doppler tests which showed there was no reduction in oxygenation to the penis. It can be worn all day as long as it's loosened every hour or two, and patients will urinate, tighten it back up, and go about the day. Really popular with patients, for example, that are looking for a solution while they exercise, or maybe while they go to the football or rugby, so they can make it to half time without leaking, empty out half time, and then make it to full time. Can be worn by swimmers as well. It's waterproof, washable, reusable, can last for 8 months or more. And it comes in 3 sizes, but there are 4 micro adjustments in each size, so basically 12 micro sizes. So a very popular device, particularly popular with patients that are waiting artificial urinary sphincter surgeries. Next, we have the Whatever washable garments. You can see there's a wide range of different styles. There's boxes, there's briefs, and these are washable undergarments with a built-in pad that absorb urine, neutralize the odor with the help of antimicrobial fibers that reduce odor-causing bacteria, as a waterproof outer layer to prevent leakages. And it's available on NHS supply chain in most of the UK. Not currently available in Wales on supply chain, however. So continence teams in England and Scotland can provide them. It's really great for the environment compared to disposable pads, which could take up to hundreds of years to biodegrade in landfills. They each last 200 to 250 wash cycles. Fabric softeners and bleaches shouldn't be used, and of course they shouldn't be ironed. But they can hold up to 650 milliliters depending on the model. So a great alternative for those with stress incontinence. And we also have the Men's Liberty external catheter system. So this consists of a petal sheath. So the petal is folded over the glans penis. A barrier film is used to optimize the adhesive and to help protect the skin. And once the faceplate seal is applied, the urine is only able to funnel down into a small pre-attached 240 milliliter bag on the Men's Liberty system. And any other catheter bag, leg bag, or bed bag can be inserted into the bottom of that with the help of the universal adapter. So it's an external catheter system that ensures that patients with a retracted penis can be accommodated. So men that have had a severe penile retraction, they're notoriously hard to find a suitable product to help keep them dry. And so the Men's Liberty system is specially designed for retracted men. We also have the Men's Liberty acute system, which has no pre-attached bag, so that the carers and the patients can use any additional bag that is required. So if they've found that certain other bags work really great for them, but they just have an issue finding a suitable securement system to the penis, then this is a great alternative. Available on prescription as well. So clinicians can provide a starter kit, a pack of 4 basically. Once the patient's determined that it's ideal for them, they can then have it prescribed by the GP in boxes of 10. So that's an overview of Imedicare's andrology and male urology urinary incontinence products. You can get in touch with us through our website or contact imedicare.co.uk. Our website is mypelvichealth.co.uk, where you can find a lot more information, patients and clinician orientated information. And if you have any questions, feel free to email us.